Welcome to today's session titled Conversations with GIA, Housing as a Fundamental Component of Aging Well. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join by phone call or computer audio. If for any reason you'd like to change your selection, you can do so by accessing your audio pane in your control panel. You have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce John Feather, CEO of Grantmakers and Aging and moderator for today's webinar. John?
Thank you so much, Tracy, and welcome to all of you. Thank you for joining us today. As always, we want to thank the John A. Hartford Foundation for the support of today's webinar and our entire Conversations with GIA webinar series. Housing is fundamental to the ability of older adults to age well. In recent years, community-based settings, including the home, have become integral to the delivery of health care and social supports. We will present a wide lens on the housing ecosystem and explore how aging funders can play an integral role in the growth and sustainability of housing as a social determinant of health. Through this discussion, Grantmakers and Aging will identify areas for deeper exploration and learning on the housing industry and its role in supporting healthy and purposeful living. We are very pleased today to have two speakers, Alisha Sanders, who's Director of Housing Plus Services Policy Research for LeadingAge, and Kelly Kent, who is the Senior Program Officer for Elders at the May and Stanley Smith Charitable Trust. We thank you both for being with us today. As was mentioned earlier, you will have a chance to enter your questions to our panelists, and you can do that at any time in the question box on the right side of your screen. I will collect these and read them to our presenters when we get to the Q&A portion. So first, I want to turn it over to Kelly Kent. Kelly?
Thank you, John. It's a pleasure to be with you here today. Again, I'm Kelly Kent. I'm with the May and Stanley Smith Charitable Trust. We fund in several areas, including older adult programming, which I oversee. We fund in 14 states on the western half of the U.S., and we typically fund direct service programs and systems change activities. Aging in place is one area that we fund, which includes an array of housing settings. In my work at the intersection of health and housing for the past 20 years, I have found that housing is a fundamental social determinant of health that fosters good health and corresponds to aging safely and well. We recognize this in our own lives as we witness loved ones like our grandparents, parents, or even our partners and ourselves as we age. Those natural changes are only magnified when we look at communities that have experienced long histories of inequity and access to resources. It becomes clear that home environments and the linkages to supportive services when needed are critical to avoid chronic illness, isolation, and unnecessary repeated engagements with formal healthcare systems. But sometimes the topic of housing can seem daunting to funders. The continuum of housing is broad and encompasses everything from homeless prevention, supportive housing, independent living, and long-term care settings, both medical and non-medical, to aging in place within your own home, whether rental or owned, and modifying it to meet the needs in your later years, leaving folks feeling sometimes like this issue is just too large to address. That's why we are really excited to have you all here with us today. Today's discussion, Housing as a Fundamental Component of Aging Well, will provide a nice overview on the topic and will hopefully provide each of you the ability to identify potential sub-areas on the continuum that resonate for you and your organization. As we know, the intersectionality between healthcare, housing, transportation, food, and economic security all coalesce and ultimately impact the success of individuals to age well. Discussions on this topic began at GIA's conference last year in New York City. It is through discussion between my colleagues, along with the leadership of GIA, that this conversation has been made possible. For that, I thank John and his staff for his leadership and openness to bringing this conversation to GIA members. We are lucky to have Alisha with us today to ground us in research on this topic. Her more than 20 years of experience in housing and aging services gives her a unique perspective to help shape our conversations about home and how housing truly is healthcare and fundamental in assisting us all to age well. We will have Alisha conduct her presentation and conclude with some examples of how this can come alive for philanthropic funders. Then we'll follow up with some Q&A, and John will close us out. With that, I'll turn it over to Alisha.
Perfect. Thank you, Kelly, and thank you to all of you for being here today. I'm excited to talk to you. As Kelly stated, housing for older adults can really span a spectrum of different types of settings, and I am going to talk to you at one end of the spectrum today. Tracy, if we could go to the next slide, please. Great. So as I was saying, I'm following up on what Kelly said about how housing for older adults really spans a spectrum. On one end of the continuum, it's independent housing, like single family homes or apartment homes where individuals live in there, and they may or may not have services depending on their needs and what they bring in. And the other end of the spectrum is nursing homes where individuals live and can receive a more intensive, pretty high intensive level of care. And so where I'm going to concentrate today is on this independent housing end of the spectrum. And you can't see me, but I can let you know that I'm kind of putting that independent in quotation marks because that can have different meanings, and you'll see what I'm talking about as we go along. I'm going to be sharing some high-level information related to two key functions areas that housing can play for older adults, and that's its role as a social determinant of health and its role as a platform for aging in community. So the next slide, please, Tracy. So many of you are maybe familiar with the term social determinant of health, and many of you may be making grants in these different areas, but just to kind of make sure we're all on the same page, a social determinant of health is the social, economic, and physical conditions under which people are born, grow, live, work, and age. And you can see in that diagram on the left some examples of social determinants of health that really can affect a person's health, risk, and outcomes. So what is becoming more commonly understood and accepted is that health is not determined by medical care alone. There are several other factors that bear on a person's health behaviors and health outcomes. And housing is one of these key factors. So next slide, please. So there's been a good amount of research on the impact housing can have on a person's health. And I won't go through everything in these slides. This will be some information for you to have to read later. But the research is focused on some key areas like affordability, the quality and accessibility of the physical structure, and the location of where housing is. And the research has found that these elements have a bearing on a person's physical and mental health and well-being. Next slide, please. And related to social determinants of health, I would be remiss to talk about housing for anyone, but particularly for older adults, without talking about housing inequities. So today's neighborhoods are really shaped by mortgage lending and policy practices that were established almost a century ago, when as a national policy, we rolled out some formal policies that restricted lending to neighborhoods where mortgage lending to neighborhoods where persons of color resided. And we also required a lot of developers to put restrictive covenants in their development that prevented persons of color from buying homes. Many of you have probably heard the term redlining, and that is what I'm referring to here. And these practices were legal until 1968 with the passage of the Fair Housing Act. And even though they were made illegal in that year, we know that discriminatory and predatory lending practices have continued through today, and that racially segregated neighborhoods persist. And the impact of these practices is large, particularly for if you think about the generation of older adults today. Many of them were forming their households, and which often lead to your first purchase of a home prior to these practices becoming illegal. So it has impacted this generation and the generation coming right behind it, the pre-retirees, immensely. And that impact resulted in a lower opportunity for older adults of color to purchase their home. If they were able to purchase a home, they were often limited to neighborhoods where homes saw and see lower rates of appreciation. And because home ownership is a primary vehicle for wealth building in the US, this has diminished older adults of color's opportunity for building wealth. And it also has trapped them, many of them, in economically disadvantaged neighborhoods, which relates back to the previous slide and all the impact that the social determinants of health can have on a person's health and well-being. Next slide, please. So I'm going to go through and highlight a few kind of key characteristics about housing that, as I said, kind of speak to this social determinant of health and platform of aging aspects of housing. So in the graph on this slide, you'll see that there are almost 31 million households age 65 and above. And most of us know that most older adults are homeowners. You can see almost across all older adult households, almost 80% own their own home. But alluding to those housing inequities that I just spoke of, it's really important to look at these home ownership numbers by racial and ethnic categories. And you can see how this plays out here, where white older adult homeowners have about a 20% difference between home ownership amongst Black households. So, next slide, please. And this is a little bit of information about the composition of older adult households. About 35 million of the of 50 million households age 65 and above either live alone or with their spouse or their partner. And you can see a large majority of those people, 42%, live in single person households. And the data also shows us that living alone increases sharply with age. So you can see that the big increase, up to 57% of households age 80 plus live alone. And many individuals, as they age, and you all know this, that they have higher disability rates and lower incomes than same age couples. So that just this is just speaking to the potential that older households, older single households may have more needs, care needs, service needs, and may not have the support system within their household. So it's telling us that we have to think about types of settings and how we connect services and resources to those settings. Next slide, please. So a large majority, 70% of individuals aged 55 and above, I'm sorry I didn't have the data by the traditional older adult age range, but 70% of older adults aged 55 and above live in houses that were built before 1990. So the overwhelming majority of older adults live in houses that are over 30 years old, and a large percentage, 40%, live in homes built before 1970. And so you can imagine that these older homes may have a higher likelihood of structural and system repair needs, which could become more challenging, particularly for lower income older adults to be able to afford to take care of. Next slide, please. This is sort of a complicated chart, and I'm not going to go through all these numbers for you. Again, a little more data for you to read later. But I wanted to give you a sense of the accessibility features that most houses in the US, and this chart includes both single family homes and apartments, the accessibility features they have in them. And this data comes from a study that a group did where they tried to look at houses that could accommodate sort of different levels of accessibility needs. So that first column, the potentially modifiable column, shows that only about a third of houses have some of the essential structural features that a person would need to live in their home as they started to have mobility challenges. And then the next column over adds a few more key features that would be needed to live in a home if you had moderate mobility difficulties. And you can see the percentage of homes that meet those standards drops dramatically to only 4%. And then if we went all the way to homes that needed to be accessible to a person in a wheelchair, you can see that it's virtually non-existent in this country by the accessibility feature standards that these groups have set. Next slide, please. And this slide is just looking a little bit about income and wealth of households, and in particularly trying to draw the differences between owner households and rental households. So if you look at that top chart, which is looking at the median household income in 2017, you can see that there is a pretty big difference between owners and renters. Not surprisingly, renters tend to be lower income, but I don't want to overlook the fact that there are a large number of homeowners, older adult homeowners, who are also lower income. And you can also see that these incomes decline with age. So as a household maybe is aging and maybe seeing increasing need for services or resources or adaptations to their home, their income is actually decreasing. And that bottom chart looks at wealth. And part of the reason I'm looking at wealth is also looking at the resources that a household may have to draw on to for those any additional service and resource needs they may need to for in-home care, adaptability features, or other needs as they age. And you can see a very large household wealth difference between owners and renters. And a large percentage of homeowners, older adult homeowners' wealth is their home equity. And this is particularly true amongst older homeowners of color and lower income homeowners. So even those homeowners may have more wealth, it's largely tied up in their home and isn't liquid should they need funds for emergencies or funds to fund regular ongoing services. Next slide, please. And related to the income discussion is looking at housing cost burden. And in the housing world, we kind of set the standard of what's affordable at 30, that paying no more than 30% of your total income for housing costs. And if you pay above 30%, we call that housing cost burden. So there are almost 9 million households age 65 and above that are housing cost burdened. And you can see this happens with both owner households and renter households, but not surprisingly, renter households are disproportionately housing cost burdened, 54% compared to 26%, of owner households. And there's a lot of different reasons for housing cost burden. This is, housing cost and income combined. But one of the ways that for renters, that we can try to address housing cost burdens is through federal housing assistance. That could be through apartment buildings that are targeted to individuals with lower incomes and receive assistance to where they only pay 30% of their rent, 30% of their income for rent, or in giving them vouchers where they can go out on the open market to rent a unit, and the voucher helps subsidize their rent. But despite the large number of lower income senior households, only 1 out of every 3 older adults that's currently eligible for federal housing assistance receives it. So you can see there's a big gap in people that are eligible for housing assistance but don't receive it. Next slide, please. And so not surprisingly, related to this, we are seeing a growing incidence of homelessness amongst the older adult population. In 2017, data found that about 1/3 of all homeless individuals were age 50 and above. And in the homeless world, we talk about older adults as being age 50 and above, as in comparison to that more standard 65 and above. Because what they have found is that individuals who are age 50 and are homeless have the same health and functional complications as someone who is 65 or older. So you can see that how the proportion of older adult homelessness has grown over the years. And you can see that in 2017, about 33%, 34% of persons in shelters were 50 years old and above. And there's a couple different pathways to getting into homelessness for older adults. One of the major pathways is a birth cohort effect. So there has been a portion of in the late baby boomer cohort that has sort of aged through life, facing many complications, and has had some chronic homelessness throughout their lifetime. But also, there are a lot of people that have entered homelessness for the first time after age 50, and that's often due to financial insecurity, earning low wages, and housing unaffordability. Next slide, please. So one other thing I want to talk to you about is the development of alternative housing types and arrangements. So the kind of traditional standard types of housing is a single family home. That's where most older adults live and have lived. Many older adults also live in traditional apartment complexes. But there has been a growing increase in developing alternative types of housing that can help address some of these issues that we are seeing and concerns that we're seeing amongst older adult populations. So addressing some of those issues I've talked about of affordability, thinking about how in the housing setting we can help to support people's needs as they change and become more intense. And also, how can we help people stay socially connected and engaged? So you all have probably heard of some of these housing types. There's been a lot of interest in accessory dwelling units. These might be referred to as granny flats, in-laws, suites, garage apartments. There's also been growing interest in shared housing. This could be where a group of older adults rent a house together, where an older adult owns their own single housing and their own single family home, and they bring in a renter who may be an older or younger person to live with them. And also related to that, the development of cooperatives and co-housing, which can be take on different types of arrangements, but essentially it's groups of some types of housing units that are built in a collective way where there's purposeful connections and engagements and shared community space and activity across the household units. So there's some challenges, and although there's a lot of interest in all of these kinds of developments, several of them have been slow to take off. And part of that challenge that they face is local land use policies that prevent them from expanding and growing. And some of the things they do is they prevent certain types of housing. So neighborhoods are zoned for only single family homes, and they don't allow multifamily or multi-unit kind of developments. They also land use policies also put a lot of lot and building requirements, like requiring a certain amount of parking spaces or setback from the street, or only taking up a certain percentage of the lot with the housing development. So a lot of the things can inhibit these kind of alternative forms of housing from really taking off and scaling up. And another part of the challenge is that sometimes they can be expensive to design and construct. So you see a lot of cooperative and co-housing units taking off for higher income populations, but they really have struggled to make them affordable to lower and moderate income older adults. Next slide, please. So finally, I want to talk to you about one particular strategy, and this is called affordable housing plus services, or that's what we call it. You might also hear it referred to as service-enriched housing, sometimes supportive housing. The idea that it is independent, affordable housing connected with services in some way. And generally, when I say independent, this means there's generally a landlord-tenant relationship between the older adult and the housing organization. And there's affordable means there's some type of subsidy arrangement to help lower the rents to lower income people. And then there's on-site services and programming, and this can vary across properties. It's often anchored by a role called a service coordinator. This is a key function that helps the residents identify and access needed services and resources in the community. And the services and programming that are available at the property can really vary. They can include things like on-site meal programs or pantry programs where residents can get groceries, various fitness and exercise programs, health and wellness programs like education or chronic disease management or flu clinics. Some sites are able to provide transportation to help the residents get to grocery stores, doctor visits, pharmacies, and then often a lot of social type programming to help keep the residents engaged and connected with each other. And these services are delivered by the housing staff sometimes, and often in partnership with community organizations. And they can be funded in various ways. The housing property may have some funding for it. The community partners may just deliver their service on site as part of their regular delivery mechanism. And sometimes many wonderful philanthropists like you all provide grants to support these programs. Next slide, please. Thanks. And there has been a growing level of research on these models, some by my group at LeadingAge and other colleagues around the country. And the research is showing that these models are driving lower hospital use, both hospital and ER use amongst residents. They are slowing, this lower use of these high-cost health services is leading to slower Medicare expenditure growth. And they're also seeing that it's increasing higher value healthcare use around residents. So they're seeing more use of primary care, dental care, mental health care. So there's a few, these programs exist across the country, in every state, in properties that are supported by HUD, the Low Income Housing Tax Credit Program, rural housing, and other state and local funding mechanisms. But as you saw earlier, only a third of older adults who are eligible for these kind of programs receive access to them. So there's a need, if we want to be able to expand these kinds of programs, we need more affordable housing. And we also need to support development and sustainability of the service partnerships to bring in the services and the funding to support those. Next slide, please. So I'm going to wrap up, and Kelly's going to jump in here with me and talk about some of the opportunities that everything I just talked about presents for foundations like you all. So one of the first areas is around these issues of affordability. As I mentioned, we have a need for more affordable housing. So there's an opportunity for foundations to assist or support the development of either new properties or rehabilitation of properties through gap financing, through rental assistance, and it doesn't all have to be financially. There's also an opportunity for foundations to advocate for more federal and state and local level funding for affordable housing. The other thing I want to mention with rental assistance is There are different ways to do that. It doesn't necessarily mean that it has to be on a large scale to a large number of individuals. Some programs provide shallow gap subsidies to older adults who are facing an emergency, and this gap financing would help them, the shallow subsidy would help them with paying rent for 1 month or 2 months or something, and that could prevent them from being evicted or losing their home. Another opportunity is supporting programs that assist with home modifications and or rehab. So there are a lot of lower income older adults who struggle to make needed upkeep and repair to their older homes, or to make the accessibility adaptations that help keep them safe in their homes. There's also an opportunity to fund housing-based services programs like the ones I was discussing, where you can help fund a service coordinator role or different types of service programs. And there's also, we're really trying to figure out how to help support these programs to work better with healthcare. So potentially some pilots to figure out how those two entities how housing and healthcare can better collaborate and coordinate their partnerships in these properties. One thing I haven't touched on, but is an opportunity for philanthropy in housing, is around technology access and capacity. And COVID has really bubbled this to the need to the top for us. So many affordable housing properties do not have building-wide Wi-Fi or broadband access, and many residents, either in these affordable properties or in their own home, do not have the technology equipment, whether that's laptops or iPads or even smartphones, and the capacity to use it. So as we're talking these days about how telehealth, about how COVID has really helped telehealth bubble up to the top to keep people connected with their healthcare or to help provide social engagement opportunities, there's a big gap in affordable housing communities and with lower income older adults in their ability to do this. And finally, there's an opportunity to help expand these alternative housing types. And this could be by supporting the organizations that develop or facilitate these kinds of activities. And also, again, thinking about your potential role for advocacy for land use reform. So if your foundation is is an organization that looks locally at the needs in your local community, there's a lot of land use reform discussion going on around the country now. A lot of cities are looking at, are reevaluating their zoning programs to open up opportunities for more multifamily housing in all neighborhoods and these types of alternative housing such as ADUs. So you might also consider how your foundation can get involved in that advocacy type work. And Kelly, I wanted to give you the chance to jump in and talk about some of these opportunities.
Thanks, Alisha. Yes, I think rooting this in some real world examples can be helpful and hopefully spark some questions and conversation. And, I just wanted to offer that really the engagement around housing settings is possible whether you're in a large, medium, or small foundation. I think most of us are aware of the really innovative partnerships that are taking place in different parts of the country. Here in the Bay Area, there are large partnerships and philanthropic pooled funding scenarios where large funders are leading conversations like the Chan Zuckerberg Foundation. And that is very exciting and provocative conversations around how philanthropy can add a great deal of value in increasing the level of affordable housing at a macro level. But I also think that medium and small foundations can play an important role in these discussions. Examples are, my colleagues like the Weinberg Foundation that funds capital and pre-development, as well as home modifications coupled with healthcare services like Capable, or the Retirement Research Foundation that funds an array of programs, including research of emerging models. I think that those are some really interesting examples. And then personally, I would just offer that the Trust has funded direct services and systems change work in a number of areas. We have grantees that as a part of their affordable housing efforts, conduct home share matching programs where they work to identify individuals that own homes in the community and work to do matching with individuals looking to rent and identify a roommate. We also look at programs that provide supportive services on site within existing affordable housing and independent living settings. And that can be, in terms of size, funding an additional resident service coordinator, or potentially providing opportunities to layer in additional services like a transportation component with the purchase of a van, or helping to cover the costs of an additional staff person to provide those services, or linking those services to an existing transportation provider and community. Also, we look at how food security programs, arts and culture programming, or wellness programs can be linked to affordable housing. We have grantees that are providing really enriched arts and culture programming for older adult clients in affordable housing that significantly reduce the isolation of older adults in those housing settings, especially given the real world implications of COVID-19 that we're all living through currently. We also fund intergenerational models, things like grand family projects where a grandparent may be helping raise grandchildren, or programming that specifically identifies older adults as a key component or volunteer within younger education programming or mentor programs. We also look at systems change activities and groups that are providing legal protections as a form of homeless prevention, as well as elder justice programs and elder abuse prevention programs. There are four, as an example, there are four county ombudsman programs across California that are nonprofit and 501c3s that provide these types of services. And the Trust has funded some of those programs in the past and presently. And then last, I would just say that the systems and culture change work is going to be really important at all levels of government, local, county, state, and federal, as we move forward and we see the drastic increases in demographics of older adults and the real world implications around affordability in our community. So identifying organizations that provide culture and systems change that focus on the longer game around affordability or around permanent supportive housing for elder homeless individuals. Those are areas that we are actively looking at as well. And so, there are an array of ways that philanthropy can get involved in these discussions and really add value without having large grants being needed to do that work. And so those are just some real world examples that I think, kind of help root the examples that Alisha provided in some ways that we have actively sought out grant recipients and grant partners to do work in this space. With that, I'll open it back up to John, and I believe we're going to move into some Q&A.
Yes, we are indeed. Thank you both for your wonderful presentations and words of wisdom here. So several questions have come in around the federal role in this. As has been pointed out, the U.S. government has been central to building a lot of affordable housing and particularly providing subsidized rent and other kinds of mechanisms for low-income older people. So two questions. One, do you see the federal role seems to have decreased in the last few years? And do you see that continuing or changing? But more to the issue that Alisha raised about providing services within the context of federally supported housing and the sometimes not very helpful role that the U.S. Department of Housing and Urban Development has played in that, because they feel that the building is really only to house people. It's not really a service provision agency. So I'll send that one over to you, Alisha, and then Kelly can comment as well.
Sure. So yes, for sure, at the affordable housing has been largely funded at the federal level. For most of history through the U.S. Department of Housing and Development through various programs, and that's most properties now are funded in some way through there. But as you mentioned, HUD has largely stopped funding new housing development. So about 20 years ago. And the only program that has continued, although it did stop for a little while, but it recently restarted to produce any new units, is a Section 202 program, which is a program that is specifically targeted for older adults. But the scale of that funding is infinitesimally small in the respect to the need. The predominant funding source for affordable housing now is something called the Low-Income Housing Tax Credit. And this is really a tax program. It's operated through the IRS, really, where the states get an allocation of tax credits and they sell them to gain equity I'm really dumbing this down, to gain equity to build new housing. So this is great. It is keeping the production of housing going up. The downside of the Low-Income Housing Tax Credit program is it doesn't come with rental assistance. So it's not affordable to the lowest level of older adults. And many of the older adults that live in affordable housing now, the average income is around a little over $13,000 a year. You can't afford a low-income housing tax credit unit on that level. So there definitely is really a need to increase not just production of housing, but rental subsidy for the lowest income older adults. And I think this is an area we have really relied on the federal government for this, but I think this whole concept of producing affordable housing from all different angles, we really need to start also bring other levels, state and local levels, into the conversation as well, because while they may not be able to fund on the same level, they can add funding and they can make changes to regulatory requirements that can impact costs. To your question about funding the services in housing, HUD has very much focused on the bricks and mortar and not the services side. And many housing advocates, there's a debate in the housing world as to whether they should or not. They do fund service coordinators in senior housing, but only about 50% of eligible properties have a service coordinator, and they are just a key role, and the research shows that. But where the research is showing as a benefit accrues to is to Medicare. So we really think there's an opportunity to bring CMS and HHS into this conversation to look at potential collaboration, partnerships, and financing mechanisms for the services in the housing. that is another area of a potential area of advocacy. And there's a lot of, there's a lot of healthcare interest in affordable housing. They definitely see the value of housing as a social determinant, but there are business case challenges for them to invest in the services because of the nature of Medicare and how people pay for services. So I think there's a lot of opportunity there. And to Kelly's point about we really need some system change conversations to figure out how to support these initiatives that the research is showing benefits all entities.
Great, thank you. Go ahead, Kelly.
I would just add, John, I really appreciate you teeing up that question, because I think that, historically we talk about a three-legged stool, that older adults had savings, Social Security, and then pensions typically to retire on. And I think that the reality is that we no longer have pensions in the majority of instances for people to access in their later years. And Social Security is not extensive enough to meet the affordability challenges that we see in communities across the country. It's estimated about $1,200 a month. And so that really leaves most individuals on a very fixed income with not a lot of cushion to cover housing and medical and service costs, as well as just basic living expenses. I would agree with Alisha that Medicare is an area that is growing in its possibilities to help increase supports for older adults in community. I believe there were over 200 changes, both regulatory and policy-based changes in the past several months due to the COVID-19, things like increased telemedicine and really focusing on how to provide as much care in the home as possible to limit exposure due to COVID-19. I think that, approximately 84% of older adults and baby boomers especially have indicated that they want to remain in their homes for as long as possible. And I think that there are changes taking place within Medicare, like the Medicare Advantage program, which would allow for more innovative expansion into things like home modifications, universal design features, that would help older adults remain safely in their homes for the longer term. I think that oftentimes the reason that older adults end up needing to move and change their housing settings to congregate settings end up being that they are that they're in non-conducive housing environments, that they may be discharged from a hospital stay and get home and recognize that without service coordination or some additional physical changes to their living environment, remaining in the home setting is just going to be a challenge. And then I would say that the other piece is that there's been a lot of focus at the state level around housing settings, especially in long-term care environments. Here in California, there's discussion around a long-term care at home benefit that would be utilized at the state level to try and provide for as much care in the home setting as possible, so that individuals could remain at home for longer periods of time. And then last, I would just add that, not to be political, but I think that this topic will come up in the coming months as the Biden campaign announced a platform around universal family care, and how that sandwich generation that have both children and older adult parents are really being stretched in their caregiving needs. So I think that, as I talked about, that really ends up playing out around the discussion of housing, because whether an individual lives in a multi-generational household or is looking to try and remain in their home, the cost of services and the implications of caregiving on their families end up definitely coming into the conversation.
Well, thank you. Thank you both for that. I think we've got time for one more. So this is a question about whether you're seeing health institutions, large-scale hospital systems, for example, or insurance payers partnering with housing organizations in the community to bring in services to the older, particularly more vulnerable and lower income population. Alisha, comments on that?
Yeah, I think we are seeing some examples where like a hospital or a health system might partner to send in some type of health and wellness programming, a flu clinic or a disease education program. In some cases, maybe a fitness or education program. I think we're seeing more programming like that. What we don't necessarily see is more, and in some cases you will see like a home health agency who will send a wellness nurse to the property who might check vitals and do some education. I think we would love to see programs like that scale up more than we think they are out there. They're all valuable, but what we're hoping to see is if we can drive more purposeful collaboration between health entities, whether it's hospitals or larger health systems or health practices or like primary care practices or managed care organizations. And I think to make it more normative and scalable, we still have some issues to work through, but it's happening and there's a lot of discussions going on it. And I think there's interest on the healthcare side.
Kelly? I'm sorry, go ahead.
Alisha, were you done?
No, go ahead. I had something else to add, but go ahead because it might turn to a little bit different topic.
Okay. I was just going to add, I think that this is a really a large opportunity for funders, because I think that, as Alisha noted, healthcare systems definitely have identified that individuals that are living in non-conducive housing settings or may be frequent users of hospital systems oftentimes are housing insecure. And I think that this model and collaborative work around housing settings and healthcare settings, I found really started for me in my career with permanent supportive housing. And I think that that wasn't aging specific, but it was really focusing on vulnerable individuals in community and working to meet service needs to try and drive down engagements with hospital settings, which ultimately decrease costs to taxpayers. I've seen that since really play out with some of the large managed healthcare systems like United Healthcare, Humana. They are actively working with communities around vulnerable populations and working to identify ways that the hospital system can partner with housing providers in really looking for those points of intersection and ways that they can keep people housed with better health outcomes and better housing stability. And then last, I would say that it doesn't have to necessarily be at the large scale health system, but I myself worked on a project in Kansas City with a nonprofit hospital that identified large amounts of falls and readmissions due to falls of older adult patients, and worked and was a real leader in the community in identifying nonprofit sponsors in the community and coordinating case management similar to the Capable model out of Johns Hopkins, and then layering in minor home modifications to the home to really allow individuals to age in place. So it can be done.
Yeah. And Kelly, I just wanted to add one other example onto this, and you know, a lot of, as Kelly said, a lot of the partnerships have come around that supportive housing and homeless population, and partially not because it is a high cost population and there's opportunity to slow, you know, the multi-care use of these participants and drive down their costs. We haven't seen the same level of partnerships, I think, or investment in kind of more traditional affordable senior housing settings. But there have been some instances of that. And I think there's a lot of opportunity for this. And for example, there's one managed care organization in Southern California that is partnering with a senior housing property, and they're sending a community health worker to the property 3 days a week. And this community health worker works with all residents in the building, whether they're a member of that plan or not, and helps them navigate and coordinate the healthcare system, which is really challenging for low literacy, non-English speaking older adults that are often living in these housing properties. And helps them navigate the other services and resources in the community. And it's the residents are just they can't say enough about how much they appreciate this role. So I think there's a lot of opportunity for this type of involvement. The reason it's happening here is because the health plan has a large penetration of members in the building. So we just need to figure out ways to help to grow this in other communities as well that may not have the same circumstances.
Thank you so much. We are towards the end of our discussion today, and I want to turn back to our presenters and have them give their last words of wisdom to our audience. And Alisha, let's start with you.
Wow, I think we've talked about so many things today, and I know that it was at a high level, but I hope it gave everybody at least a little bit of some ideas or some interest into talking further about how philanthropy can work around affordable housing after seeing kind of how it's interwoven through so many aspects of life and other areas that you might fund in. So I think there's a lot of opportunity here, even if your foundation isn't looking directly at housing, there's still ways to connect with it and support the housing setting, whatever that may be for an individual. So I really want to thank you guys for having this conversation and inviting me to be a part of it, and hope I can continue to help you all as you continue the dialogue.
Thanks very much. Kelly?
Thanks, John. Again, it's just been a real pleasure to be here today and to engage in this conversation. I think there is such room for growth. I think that oftentimes in philanthropy, we function in the traditional vertical kind of programmatic silos. And I think that there is such opportunity for us to approach our work through kind of an intentional intersectionality, and really looking at whether we fund food security or community engagement programs or wellness and supportive services or transportation. Regardless, I think looking at how those programs and applicants that are applying are looking to identify those other social determinants of health, and how real flexible funding that is afforded to philanthropy, how that flexible funding can help fill gaps and help kind of connect the dots between those sometimes discordant systems of care to really focus on the whole person. And I think that issues around housing insecurity will unfortunately continue to grow around older adult populations, especially with everything going on in the world right now. So we, I think, needing to think outside the box and how we can really collaborate around this issue.
Well, thank you so much. I do want to thank Alisha Sanders, the Director of Housing Plus Services Policy Research for LeadingAge, and Kelly Kent from the May and Stanley Smith Charitable Trust. We at GIA are in discussion on developing a funders-only collaborative around housing and aging. So you will be receiving a survey from us asking questions of your potential interest and also the areas in which of this very broad field that you might be interested in this collaborative. I also want to thank the John A. Hartford Foundation for their continuing support of today's webinar and our webinar series. And we hope you'll join us for the next Conversations with GIA. We will be making today's presentation available to anyone who wishes to view it later, both the slides and the audio. Please watch for an announcement to be sent to you in a few days, or it's always on our website. So we thank you all for participating today. Please stay safe.